Hello everyone. Welcome to Physio TV Classroom session. Myself, Dr. Tushar Sathe, Assistant Professor in Sancheti College of Physiotherapy. So, in today's session, we are going to see PNF technique for improving respiratory function. Firstly, what are the objectives of these sessions? So, firstly, we are going to know what is chest PNF. Then, what are the techniques to improve respiratory functions? How to apply these techniques to improve respiratory functions, and its contraindications and the indications. Now, firstly, we will see what is chest PNF. So, for the chest PNF, it is the externally applied proprioceptive and tactile stimuli which is applied externally, and it produces reflex respiratory movement in the patient. So that is the chest PNF. Now, firstly, we are going to see what are the respiratory assessment which you need to do before giving the chest PNF to the patients. Firstly, we have to auscultate the patient. In that, we have to see what auscultatory findings you get previously or before the treatment and post treatment. We have to check and assess pre and post result. Then we have to check for the respiratory movement pattern. So what is the movement pattern which is patient is following right now? That you have to see. Then check for the thoracic movements. So in thoracic movements, we have to see how the thoracic movements are happening. Is there any alteration for the thoracic movements? That we have to see. Also, we have to look for any paradoxical movements. The paradoxical movements are the inverse movements in the patient. Also, we have to see any areas of indrawing on inspiration. So, whenever patient takes a breath or inspires, that time any area is getting indrawn, that we have to see. So, once you have done with this assessment, respiratory system assessment, then we will see after you have applied the PNF techniques, what you can see, as in after application of PNF, what is the result of applying chest PNF. So firstly, we can see a visible deeper respirations in the patients. Then we can see better expansion of the chest, as well as there are increased epigastric excursion. So epigastric excursion will increase and we can see a good expansion, chest expansion in the patients. Then there are increased visible and often palpable tone in the abdominal muscles. So after the treatment, if you are palpating the abdominal muscles, you can see there is increase in tone. Also, there is change in the respiratory rate of the patient. So if the respiratory rate is higher in some patients, then this technique will help to reduce the respiratory rate. Also, patient may involuntarily cough after the chest PNF is given. This technique will help in normalizing the respiratory pattern. And once the pattern is improved after the treatment, it retains for a time. So these are the results you will get after applying chest PNF. So now we are going to see what are the techniques which are there in the chest PNF. Firstly, we have perioral pressure, then intercostal stretch, then vertebral pressure to the upper thoracic spine, vertebral pressure to the lower thoracic spine, co-contraction of the abdomen, anterior stretch lifting of the posterior basal area, maintained manual pressure. So these are the techniques which are there in the chest PNF, which we are going to see one by one in this session. So firstly, we are going to see perioral pressure. So first technique is perioral pressure. In this technique, we are going to apply a firm maintained pressure to the patient's upper lip. That is in between the upper lip and the tip of the nose. Okay. And we have to maintain the pressure for the length of time. Now, once you have applied the pressure, then what response you can get? So firstly, what you will get is brief period of apnea for 5 seconds and followed by epigastric excursion. So as the epigastric excursion is increasing, these movements will be transmitted to the upper thorax. As these movements are transmitted to the upper thorax, patient may appear to be deep breathing. So once the epigastric excursion is increased, these movements are transmitted to the upper thorax, and you can see upper thoracic movements are increasing, and you can see the patient is deep breathing. In some patients, you might see a different response. That might be if you apply a perioral pressure to the patient, then you might see a sigh response first. Patient may sigh first, and then you can see epigastric excursion, as well as it is transmitted to the upper thorax, and patient may appears to be deep breathing again. So it is a primitive reflex. It is response is related to the sucking reflex. Now we are going to see how we can apply perioral pressure in the patients. So here we can see the patient is in supine line position. Therapist is standing aside by the patient, and you have to apply perioral pressure at the upper lip. Then you can see increased epigastric movements in this patient. Okay, now we have seen the first chest PNF technique. We are going to see the next chest PNF technique. That is the intercostal stretch. So intercostal stretch, as name suggests, it is the stretching of the intercostal muscles. Okay, so how we can apply this? So for applying this, you have to apply pressure to the upper border of the rib and stretch the intercostal muscles in a downward direction. So once you have applied the pressure on the upper border and stretch has given to the in a downward direction to the intercostal muscles, you have to maintain that stretch while patient is continuously breathing. So once you have applied this pressure, so what response you will get is the area which is under a stretch. There you can see increase in the area or expansion in the area. So this technique you can perform bilaterally and unilaterally also. But we don't have to perform this technique on the floating ribs. Also, this technique is effective in restoring respiratory movement patterns. So, if the respiratory movement pattern is altered, if you can see the respiratory movement pattern is altered in some patient, you can give intercostal stretch in this patient. As well as it is effective in increasing the respiratory rate and SpO2. So, if you see SpO2 is dropped in some patient, you can also apply intercostal stretch in these patients. Next, we are going to see on the patient how we can apply the intercostal stretch. Again, the patient is in supine lying position. Firstly, you have to palpate the clavicle, then the sternum, and you can see here you can palpate the second rib. Now we have palpated the rib and given the stretch, and patient is breathing. So the area under the stretch, which shows the increase in the area and expansion of the chest. Expansion of the area under the stretch. So now we have seen the two techniques, that is firstly perioral pressure and the intercostal stretch. Now we are going to see the third technique. So that is, we know as it is a vertebral pressure. In this technique, what we do is, so we have to apply a firm pressure on the vertebrae. So firstly, we have to apply a pressure on the upper thoracic vertebra and a lower thoracic vertebra. So how we can apply this? With your open hand, you have to directly apply the pressure to the uppermost thoracic vertebrae. So once you have applied this pressure to the uppermost thoracic vertebrae, the response you will get is, you will get to see increased epigastric excursion in this patient, as well as relaxed abdominal wall. So this will help in the increasing the epigastric excursion. As the epigastric excursion is increased, this will be transmitted to the upper thoracic region, and patient will experience deep breathing. Now, when we apply same to the lower thoracic vertebra, then you can see response such as there is increased respiratory movements of the apical thorax. So these movements are mostly performed in supine lying positions only. So now we are going to see how we can give this vertebral pressure technique to the patient. So firstly, the patient is in supine lying position. Here, ask the patient to slightly take his chest up, or you can take the patient manually to the side and put your hand on the vertebra and make the patient supine. Now, previously we have applied on the upper thoracic. Now we have applied the pressure, vertebral pressure, in the lower thoracic region. Here you can see the increase in the chest movements. The next technique which we are going to see is the co-contraction of the abdomen. So firstly, for the co-contraction of the abdomen, what we have to do is, we have to place one hand on the patient's lower rib and one on the pelvis on the same side. And we have to push with a moderate pressure so that force is applied at the right angles to the patient. So once you have applied this pressure, that is co-contraction of the abdomen, then you get a response like this procedure will produce a stretch on the abdominal muscles. Firstly, on the opposite side, that is contralateral side. Then this activates the muscle spindle and in turn would cause the homonymous extrafusal muscles to contract. So once these muscles are contracted, then the stretch is activated and the muscle spindles in these muscles are activated, which in turn activates their own extrafusal muscles. So a contraction would result and a muscle on the other side would again be in a stretch. So as these muscles are getting stretched and muscle spindles are getting activated, the movement is increased and it is transferred to the upper thoracic region. Now we are going to see how we can perform co-contraction of the abdomen. The patient is in supine lying position. Therapist is in a side of the patient, standing aside of the patient. Now you have to place a hand on the lower ribs and the pelvis and give a pressure. That is co-contraction of the abdomen. Again, here you can see this is a co-contraction of the abdomen. Okay, now we have seen the co-contraction of the abdomen. This will help in the increasing respiratory rate. Now we can see the other technique is the anterior stretch basal lift technique. So in this technique, what we are going to do is we are giving anterior stretch and basal area, it is posterior basal area, which is going to be lifted. So firstly, what we are going to do is we are placing the hand under the posterior ribs and patient is in supine lying position. Then we gently lift upwards and we maintain this lift. So this position will provide a maintained stretch and the pressure to the posteriorly and it stretches anteriorly. So this will help to increase the movements of the ribs in the lateral direction as well as in the posterior direction. And this will increase the epigastric movements of the patient. As the epigastric movements will again increase, it will help in the respiratory movements. So that's how we can perform the anterior stretch basal lift. Now we are going to see a video how we can perform this technique. So firstly, we have to put the hand on the posterior ribs. And then here we have given the stretch. That is, we have lifted anteriorly. Here you can see lateral expansion of the ribs and increased epigastric excursion. So that's how we can perform the anterior stretch basal lift technique. Next, we are going to see is a maintained manual pressure technique. So, as its name suggests, it's a maintained manual pressure, but we can call it as a maintained manual contact to the patient. So, what we have to do in this technique is, we apply a mild pressure with our open hand and we have to maintain it over the area which is in expansion, which we need to expand. So this technique can be useful in obtaining expansion in painful situations, such as in the presence of chest tubes. When chest tubes are or intercostal drainage tubes are placed at that time, we can use this technique for expansion. Otherwise, we can use this technique in the patients of cardiac surgery patients. Then we can use this manual contact technique. It is really useful when applied over the posterior chest wall of patient with chronic obstructive lung disease. So in COPD patients, you can apply this technique on the posterior chest wall to expansion of the chest. We'll see how maintained pressure, manual pressure can be done. So here, with your open hand, you have to put the pressure, mild pressure, on the chest wall. So as you can see, there is increased expansion in that area. So tactile stimulus will help in increasing the expansion in that area. Now, as we have seen all these techniques, but for how much duration we have to do these techniques? So for that, it depends on how patients responds to these techniques. So you can do this technique until the desired effect which you needed is achieved. So till now, we have seen the techniques, how we can perform the techniques in the patients. But how much duration and how we have to continue with this treatment, that we are going to see now. So the patient's response will determine the duration of the treatment. So how much duration treatment you are going to give to the patient, it will depend on how patient responds to your treatment. Then you can continue your treatment until the desired effect which is there is achieved. Also, many patients remove secretions by cuffing after giving the PNF technique. But also we have to note that every patient will not necessarily demonstrate the same level of response which is there. But the response, it is related to the pre-existing muscle tone on the level of consciousness and adequacy of ventilation. So if the pre-existing muscle tone is good in the patient, then you can get a good response in these patients. If the level of consciousness is good, then you can get a good response with this PNF techniques. And it is also dependent on the adequacy of the ventilations. So this is how we can perform the PNF technique, chest PNF techniques on the patients. And these are the techniques which we can apply on the patients. So these are my reference. Thank you so much for joining this session. We'll see you in the next session.